Bismillahirrahmanirrahim. Our lectures about case study of breast mass. Radiology channel imaging case study. Breast hamartoma case study. Female patient comes to me 1 week before 32 years, complain of left outer breast pain, feeling lump at 16.8/215. Being not related to menses, discovered since 1 month by same attack and finished. No nipple discharge. This patient is crying, worry, having a family history of cancer, not breast cancer, but it's worry about breast cancer. During ultrasound examination, looking for skin is normal, no redness, no hotness, breast contour looking normal, symmetrical with both sides, left and right. Sono palpation in breast, left upper outer breast lump. Not related, left upper breast lump. Related to mass seen later on by ultrasound and mammography. A study by mammogram showing breast mass. This is left CC. As we see, breast mass well defined at outer quadrant, no calcifications. Features, characteristic feature of this breast mass, it has same distribution, same features, same density of breast tissue. It is like breast tissue, not differ from it, as in textures and distribution of fibroglandular tissue, but is isolated with witch-like capsule and well defined. This is called pseudo capsule. In left MLO, we found all this mass have same fibroglandular tissue with looking like capsule, well defined pseudo capsule containing fatty tissue and glandular tissue. It is called breast within breast. This characteristic of breast hamartoma, breast within breast. In this case, no microcalcification, no macrocalcification seen. This is right MLO, no definite mass seen. This is right CC, no definite mass seen. By ultrasound, we found this mass which we seen in the left upper outer quadrant in mammogram, seen as well defined, irregular, containing fibroglandular tissue, fatty tissue like breast tissue, breast within breast. This is character of hamartoma. As we find no signs of malignancy, no irregularity, no spiking, no infiltration of surrounding tissue, no microcalcification, and so on. Textures, not definite hypoechoic. Textures like fibroglandular tissue, breast within breast. This is breast hamartoma. It's same case. Breast hamartoma. Image of different cases, other cases of breast hamartoma. So in breast hamartoma we defined ill-defined mass, well-defined mass, pseudo capsule containing fatty tissue, breast tissue, fibroglandular tissue, breast within breast. This is other finding diagnosed breast hamartoma. CC of left breast, 52-year-old woman show an ovoid smooth margin, mixed density tumor with pseudo capsule and slight fat tissue predominance. The tumor has been stable for 4 years. This breast hamartoma of another patient at 38-year-old woman. CC mammogram reveals a little predominance of fibroglandular tissue than fat within the tumor. And sonogram of this tumor partially ill-defined margin, which is and is isoechoic with some hypoechoic component, like breast tissue. Left breast of 36-year-old woman, MLO demonstrates that fibroglandular component of the tumor is almost equivalent to fat component. Pseudocapsule also present. Tumor has no interval change with 5 years follow-up. Sonogram of this tumor displays smoothly marginated and within 5 years of follow-up displays and sonogram smoothly marginated and isoechoic mass with hypoechoic areas of fat. Echogenic strips are present within the tumor. High isoechoic and hypoechoic areas. Another woman, 44 years, show ovoid, well circumscribed, solid hypoechoic mass with several cystic areas. Breast hamartoma. Another woman, a mammogram appears a slice of salami. Slice of salami. Lobulated densities that may be dispersed within the encapsulated fat, but amorphous or slice of salami. Slice of salami lobulated densities may be dispersed within the encapsulated fat, described as slice of salami. Calcification is rare mammographic finding in breast hamartoma, but amorphous or smooth and round microcalcification are reported in some cases. It's important to keep in mind that smooth and round microcalcification reported in some cases. So it's important to keep in mind that pleomorphic calcification, speculated opacity, or a well-demarcated dense opacity in hamartoma are suspicious of malignancy. 0.1% for malignant changes in hamartoma. 0.1%. 1 in every 1,000 cases of hamartoma have a chance for malignant changes. This is breast hamartoma. Another cases, large non-homogeneous mass, as we see, with pseudocapsule, breast within breast, same looking, same view, same textures as breast tissue. Another large non-homogeneous mass of breast hamartoma. Another uniformly dense mass, breast hamartoma. Breast hamartoma of the breast. Breast hamartoma non-malignant. Same character, pseudocapsule containing hypoechoic areas, fatty tissue. Same looking on all, same density like breast hamartoma, breast within breast. Thank you. So don't forget, don't miss breast hamartoma spotting diagnosis talent eye. So keep it in mind, breast hamartoma. Thank you.